János Vincze. I'm here as vendor co-chair for IHE Europe, but originally by training I'm a medical doctor and software engineer who has always worked in medical software development. In my day job, I am the technical product manager for GE Healthcare's CT/MR post-processing platform, and I volunteer in IHE Europe. And just as Enrique said, we are in very exciting times with the EHDS. Of course, we have had multiple presentations today about what EHDS is about, but I would like to highlight one of the aims of EHDS, and it is the creation of a European single market for EHR systems and medical software. Because as you will see later, in my opinion, this is a key enabler to getting Europe ahead in the innovation game. And if you look at the timeline in a nutshell, just to again reflect that we are at the time where we have a regulation text that is final, that's adopted. We are now getting ready for the implementing acts and getting ready for all the stakeholders to do their job in making EHDS real and hopefully making EHDS successful. So, why is the success of EHDS so important for Europe? As it has been highlighted by many players, including the drug report released recently, there is an innovation gap in Europe. Because even though Europe is still traditionally the epicenter, the incubator for medical innovation, there are still global medium-sized and small companies doing all kinds of wonderful innovation in the space of medical technology, as evidenced by the number of patents filed. Unfortunately, the global focus for innovation has shifted to other regions, namely the US and China. Many times, innovative products by global companies are released with a multi-year delay in Europe, and also SMEs struggle to scale. Of course, the root cause behind this is the fragmented market, fragmented technical and regulatory environment, where a successful EHDS could bring benefits. So what's the road to this success? Obviously, we are already on a road, hopefully on the road to the success, not in small part because of the numerous projects financed by the Commission to pave the way for EHDS, where IHE Europe is part of the team recommending the new standards for the My Health at EU infrastructure. And here I would like to highlight that this is a teamwork. The logos I've selected here is just a subset of those organizations that we are collaborating with, including organizations like ETEL and HL7 Europe, where in creating the right kind of standards. And we have a big challenge, because obviously we as Europeans in general cannot afford the cost to replace all the existing systems, and it actually wouldn't be a too good idea to throw out what we already have. We need to build incrementally in an environment where the standard is not finalized. There are open questions, there are risks, And in order to capture the benefits of this new standard format and to realize EHDS, we need to productize this adoption at scale. It's also important that to highlight the specific fact that having only a standard, even if everyone uses the same standard, is not enough. Everyone has to use this, has to understand the same standard the same way, has to utilize it in a very specific manner in order to have a system where plug-and-play interoperability can be reached. And as most of you are probably familiar with, there is the so-called IHE methodology, which is a proven way to achieve this, where we started from the domain of radiology and then later expanded to other domains, where we are building conformance testable IHE profiles that are building blocks that enable vendors to build digital health products that are interoperable. What is this methodology in a nutshell? First step is that profile is created using standards from all different SDOs as appropriate to have a coherent system, and these profiles have a very specific format, very specific structure to ensure that they are understandable, conformance testable. We also have what we call the testing continuum, where from events like plugathons, where we are able to test the new stuff, the not so finalized stuff, to connectathons, where we are conformance testing the established profiles, and projectathons, where we are able to test project or implementation specific items. That is basically step 2. And if, for example, for projectathons, we have great collaborations with many national health agencies, ALGA and the Austrian agencies, maybe one of the most one of the best examples for this. And of course, step 3 is that we have a way to establish a conformance testing platform where vendors can test their systems against these profiles, even outside the events, so that so that they are able to do the self-assessment that's necessary for EHDS. And here, this is just a short example. I'm not going to the details, just to show how it's possible to build an IHE profile from multiple standards for a practical use case, in the field of EHDS for patient summary sharing. As I mentioned, IHE is actually a family. We have IHE International, IHE Europe, IHE Catalyst to facilitate the different steps of the IHE methodology that I mentioned. And as kind of closing remarks, IHE, of course, and none of the organizations can do this alone. There are other stakeholders, industry, commission, member states, and citizens that need to do their part. From these stakeholders, what I would like to highlight, because we've talked about industry and the commission, I would say extensively, I would like to highlight two, the member states and the citizens. So for the member states, in my opinion, what's important is that the member states build on the industry expertise, have as few national specialties as possible, and leverage the existing experience in the industry in terms of creating interoperable systems. And last but not least, from the citizens, I think what's important is that every one of us and everyone across Europe should be conscious of their health data, how they want it to be used, and everyone must demand the highest standard of healthcare, no matter where they are located or where they are traveling within Europe. And if all these things happen, then EHDS is the golden opportunity to bring the focus of innovation back to Europe, to enable global and local vendors to achieve success, for healthcare providers to gain efficiency, and for patients to get access to the best care. Thank you for your attention, and I invite you to our next Connect.on.